about the long-term care equality index. I brought that information to the PAFC Housing Priority Group, and we decided that it was important to make sure this tool made it to our local senior living communities. We also want to thank Larimer County and particularly the Office on Aging for helping make this event possible. We've asked Dan Stewart here today to help us all learn more. Dan is the Deputy Director of the Aging Equality Project for the Human Rights Campaign Foundation. In this role, he provides leadership and management for the Long-Term Care Equality Index and other projects to promote LGBTQ plus inclusive policies and practices in long-term care and senior services. Dan received his BA in psychology from St. Louis University and an MS in gerontology from the University of Missouri St. Louis. A Chicano transgender man and gerontologist, he speaks nationally on LGBTQ plus aging and has dedicated his career to advocating and bettering the lives of LGBTQ older adults. He's a third cohort fellow of the American Society on Aging's ASA RISE. Dan, thank you so much for joining us today.
Thanks so much for having me here today, and thank you all for being on the call and for those that will be watching later. I recently made Colorado my home about a year ago, and I couldn't be happier to be doing this work in this arena amongst an aging network that really is dedicated to a person-centered, person-focused approach when it comes to care. And I feel there's a lot of synchronicity and best practices when we reach out and try to meet the needs of those that are most marginalized that can really have a positive effect for the whole community across the board. So just to introduce myself again, I'm Dan Stewart. I use he, him pronouns. I'm the Deputy Director of the Aging Equality Project for the Human Rights Campaign Foundation. I'll make sure I'll stick my email at the end as well. Just a little bit about myself. I'm a proud gerontologist. I began my career in long-term care, specifically in activities, moving to social services and skilled nursing and assisted living for several years until I moved on to the ombudsman program. And throughout the years, have now had the opportunity to work at the intersection of policy, practice, change, and support, and uplifting LGBTQ plus older adults. A little bit about me. I am a social work professor in the School of Social Work at St. Louis University, where I've adjunct for several years, a former researcher in this field, and also come with my own identities as a person who lives amongst different intersecting identities, one of which is being a future LGBTQ plus elder myself. I like to share a little bit about how I got into this work. About 12 years ago, I was working on my master's, and I had just recently come out as transgender and began my social and medical journey of becoming Dan, of myself. And in that process, I did so in Missouri, and at the time it was difficult to access care, as well as, dealt with some loss of jobs, of family, and found myself in a gerontology course where we were instructed to take 20 minutes and write what our life would be like at 80. And so again, I was fairly new in my journey, didn't have much of a familial support. My spouse and I at that time were not legally married. I was already experiencing, losing a job because of my identity, and realized very quickly that at 80, I would most likely have to rely on formal services and supports, that I would have to rely on systems of care to really supplement my own journey and continuation of living my fullest life as self as I got older. And so I then started to look into the literature and the research, and what we found, unfortunately, and still continues today, is a population that has historically been fairly invisible, but thankfully we're seeing more vibrancy and acceptance, as well as a greater intuition to what the needs are of those in our community, and recognizing that LGBTQ older adults are part of that community. For those who may not be familiar with my organization, the Human Rights Campaign Foundation, you may be familiar with the bumper sticker periodically of our equal sign. We are the educational arm of the country's largest LGBTQ advocacy organization. Specifically, since 1984, our 10 plus programs have really focused in on how we can shape the conversation and public information about LGBTQ plus people and the challenges that they face, as well as support organizational change and practice so that we can make all areas of life for LGBTQ plus people across the age spectrum equitable. A little oversight into what we will be kind of covering today. We have a smaller group, so at any time, if you have conversation or questions or things you would like to add to the conversation, please feel free to add them into the chat. But today we're going to take some time to focus in on this population of, when I say LGBTQ plus older adults, who are they? What do we know? Give some insight in some of the best practices that are drawn from everything from some of the latest LGBTQ plus resident Bill of Rights we're seeing passed in certain states based on CMS regulations or support that we have on fulfilling residents' rights in relation to this population. And lastly, share with you about the Long-Term Care Quality Index, a biannual survey that's launching next month, at the end of next month, and it'll be open to all providers to take. So let's hop into this particular population. What we know is that our aging population is growing exponentially, and that includes diversifying as well. Currently, the estimates for those that identify as a member of the LGBTQ plus, lesbian, gay, bisexual, transgender community, those that self-identify, the thought is about nearly 3 million people over the age of 50 self-identify as lesbian, gay, bisexual, transgender, or queer, or LGBTQ+. This is actually thought to be an underestimate. If you were to actually ask folks to disclose their same-sex attraction or previous same-sex relationship, the thought is that perhaps this number would actually be double. But we are seeing a greater increase in folks being out and open with their identity. And in addition to that, also living at various intersections of multiple marginalized identities. So people of color, about 20% of LGBTQ plus folks over the age of 50 currently identify as also being a person of color. So there's going to be a lot of interlocking and interlapping needs as we look at this population. But I wouldn't be a good gerontologist if I painted a big blanket statement upon who this group is, because of the lack of national data that we have, because of, unfortunately, we see almost an accelerating aging process. We really use that 50 plus as a marker of this older adult population. That being said, there's about 3 distinct generations that actually exist within this group. It's important to take a moment to understand. Over the last several decades, we've seen a lot of positive progress and recognition of LGBTQ people in the country. However, as a population, our LGBTQ elders often have lived for decades under legal discrimination and stigma. So, for example, for several decades, and many of our LGBTQ elders lived at a time where the Diagnostic Statistical Manual, the diagnosing manual of mental illness, included homosexuality as a mental illness and pathologizing that identity. Also, a key amount of lack of visibility, the AIDS epidemic. And so many LGBTQ elders experienced a lot of substantial barriers stemming from that. So those that we see as the oldest old of this population, the invisible generation, those are individuals that have been born into a time where there really wasn't any public conversation about LGBTQ folks. No public conversation, good or bad. It wasn't until the silent generation came about of age in a time when there were starting to be consequences for publicly identifying as LGBTQ+. For example, a person born in this generation, let's say an LGBTQ+ person in their 80s, born in 1940. As an adolescent at this time, saw the federal government discharge nearly 4,500 military members that were suspected to be LGBTQ plus. In their teens, they saw homosexuality as a mental illness in the DSM. In their 20s, they saw civil unrest with Stonewall, and continued and so on. And it isn't until their late 70s, late 60s, where they saw marriage equality several decades later in 2015. So for the silent generation came about where there was some more visibility, but again, very quick messaging that there's a risk with publicly identifying as LGBTQ plus. And then our pride generation, those that would constitute, make up our baby boomer generation, really came about and of age in a time of that civil unrest, but in turn often were empowered and came out and have been out for several decades. So those that are newly entering this older adulthood segment of this population are coming in with different expectations around their outness, as well as their ability to be themselves as they age. So I've kind of mentioned tangentially some of the challenges that folks face systemically as they aged in their process and their life course experience. But I do want to share just a quick video that gives a good idea of how this affects the aging trajectory then in terms of access, support, and services as people age.
As the American public ages, so do lesbian, gay, bisexual, and transgender people. LGBT older adults face the same challenges as other older adults, including financial worries and health concerns. But LGBT older adults face additional challenges. Let's compare two women, Tina and Jackie, who were both born in 1947. In 1967 at college, Tina meets Frank, and Jackie meets Francis. On a date with Francis after work, Jackie is seen by a coworker who tells their boss. Jackie is legally fired and takes a lesser-paying job at a factory. In 1973, Tina marries Frank, but Jackie is unable to marry Francis. In the 80s, Tina and Frank have children, but Jackie and Francis are barred from adopting. After decades of hard work, in 2010, Frank and Francis retire. Tina takes Social Security spousal benefits. But because the federal government didn't recognize same-sex marriages then, Jackie is denied those benefits. In 2015, right before the freedom to marry becomes available nationwide, Frank and Francis die. Tina pays for her in-home care with her Social Security survivor benefits and funds from Frank's pension. Jackie is denied Social Security survivor benefits, and because she was not a legal spouse, is also denied Francis's pension. Their apartment was rented in Francis's name, and her state lacks non-discrimination protections in housing, so Jackie is evicted when she tries to change the lease into her name. Lacking an income and a place to live, Jackie moves into a nursing home and relies on Medicaid to pay for it. She fears discrimination if she shares stories about her past, so she doesn't talk about her life with Francis. Tina can afford in-home nursing care and has the support of her children. After a lifetime of discrimination, LGBT older adults face economic insecurity, poorer health, and reduced support networks. Find out more about the unique disparities facing LGBT older adults and how to remedy them, as well as the strength and resilience of LGBT adults at lgbtmap.org/older adults.
I think that video does a nice job of concretely playing out the impact that a lifetime of these policies that had left out folks' family structures and marriages out for several years has impacted their ability then to access a lot of the supports and services. We are seeing changes in some of these statistics, especially with younger generations, but currently as it stands, LGBTQ plus older people in comparison to their straight peers are less likely to be partnered, less likely to have children. And often these are the support systems that many folks rely on, hopefully to continue to age in place at home. But because of those often no longer existing or having very precarious care bonds, where often we see folks that are peer-to-peer caregiving, where both individuals may be struggling and having additional care concerns. Because of folks' hesitancy to access healthcare, especially preventative healthcare, we are seeing higher incidence of chronic disease, disability, and illness. That partnered with a perception that folks will not be welcomed if they were to access care, again, continues to delay folks seeking that care much sooner. So despite having a lot of the same concerns that their straight peers may have in terms of how am I going to afford this, where can I receive the best care, there are additional considerations that folks have and that we must take into account as providers and helpers, and recognizing how can we address these needs ahead of time? Because in what the literature and research is saying, AARP has been doing research with LGBTQ folks 45 plus for the last several years now, asking about their views and thoughts about aging and what their expectations are in seeking care. And when asked specifically about their concerns for being verbally harassed, physically harassed, or potentially denied care in long-term care communities, 60% of people fear that would be the case. And a lot of that is based on their poor experience from the past. If we think about when folks are needing to move into a community, it is coming back into a system of some sort, an institution of some sort, that is going to necessitate interacting with a lot of things that has caused trouble in the past. And so because of that, over half of folks being concerned. That being said, the positive thing is that when asked about if we do training, if we're LGBTQ welcoming, is that something that you want? It's nearly 90% of folks said that they want people that have been trained, that have had some conversation or acknowledgement of their identity. And so recognizing that there is this fear within our community, folks less likely to access care. There's been an invisibility for a long time, so it makes sense that as an industry, as organizations, that as providers, there are still gaps in learning what are the best practices. And so coming together, the Human Rights Campaign Foundation, in partnership with SAGE, the country's largest and oldest organization focused on LGBTQ plus aging, have really worked together to help folks formalize what does it mean to be a welcoming space, recognizing that it involves policies and procedures that are written down, that are systemically based and taught upon, that there's training that speaks about to different populations, skills, continuation and implementation of those policies, and also the environment and culture and the feeling of welcoming and belonging within a community. So recognizing these pieces, our team has developed the Long-Term Care Quality Index based on our work that we've been doing for about 17 years with hospitals, about 1,000 across the country, and for 21 years what we've been doing with our corporations. So I'd like to show just a brief video that highlights this project and what it is.
If you don't think you have lesbian,
gay,
bisexual, and transgender people in your long-term care community,
think again.
Upward of 5% of your residents are members of the LGBTQ community.
We are living in your communities and may stay silent or in the closet.
Because we are afraid of discrimination.
That's not surprising, since many of us have lived for decades under legal discrimination.
Discrimination that persists today.
There are over 2.5 million LGBTQ people over the age of 50 living in America today.
Experts predict that by the year 2030,
close to 7 million LGBTQ elders will be seeking care and services.
That's why it's more important than ever that long-term care communities like yours support us as we age. And treat us with dignity and respect so that we won't be forced to go back into the closet.
And it is often more difficult for Black and Latinx members of our community.
Fear of inadequate care and discrimination are compounded by racism.
Across the country, LGBTQ elders are not getting the care and support we need to thrive.
Let's change that.
The Human Rights Campaign Foundation and SAGE believe
that most long-term care communities want LGBTQ elders to feel welcome and get the care they need.
and deserve.
And that's why the LEI exists.
The LEI helps long-term care communities adopt better policies so that they can provide culturally competent and responsive care to LGBTQ elders.
With your help, we can change the future.
Let's make sure that long-term care communities are welcoming and inclusive to LGBTQ elders like me.
And me.
And me.
And me.
And me.
Sign up for the Long-Term Care Equality Index today.
The LEI is quite the project in the making. This is our second survey that we're opening up to the public, opening in July, late July next month, but actually has been in conversations between our two organizations for about 15 years. We've done feasibility studies with Leading Age, I've worked with different research institutes and focus groups and asking providers in the field of where are the gaps and how can we support, and recognizing that we believe that most providers want to provide an LGBTQ plus inclusive environment, but may not know what that means in practice or policies, or have the resources to play through lawyers and best practices in hospitals to determine what is the best options for communities. And so we've teamed up between HRC and SAGE to develop a national benchmarking tool and a biennial survey that's designed to both assess a long-term care and senior housing communities' current services, and also assist them in adopting policies and practices that promote LGBT inclusion, not just for residents, but also your visitors and especially your staff as well. This is mirrored after our work that we've been doing for about 17 years with 1,000 hospitals across the country, and really work as a guide to support long-term care providers and senior living providers with the resources and tool and free webinars, technical assistance, and process, and being able to really create a network and searchable database of providers that have taken the step that our community members, LGBTQ elders, those that support them, can easily find where they can find inclusive care as they age. All folks that complete the survey are recognized in our national database as well as our national report, and those that achieve a basis, and I'll go over that shortly, of criteria can achieve a tier of recognition. Folks that are in states like Colorado that do have Human Rights Act that are inclusive of sexual orientation are already ahead of the game in terms of being compliant with those policies, would automatically put you at a builder status once you complete the executive briefing training. The Long-Term Care Quality Index is a little bit of a misnomer. It is extended to all residential senior living communities. So that's life plan, skilled, assisted, independent, affordable senior housing, freestanding hospice communities, folks that provide care in more independent living setting or active adult communities recognize that there are less likelihood to find a variety of policies. So we work with those orgs to also have attainable measures, recognizing the policies that exist in those areas. In 2023, we released our report and had 200 providers across the country, 3 within the Colorado area. Currently, we're up to about 400 communities participating in this second round of folks participating, but we're looking to continue to expand the map of what it looks like for inclusion. And these are communities that have just completed the survey to those that are reaching the highest level and have all the policies in place. Although we recognize that every community is different, therefore, we really offer more of a menu of options within our criteria. Within our criteria, there's about 40 best practices for folks to pull from. The first and foremost is to ensure foundational non-discrimination policies and protections for residents, visitors, and staff, as well as providing training, and we support you all with connecting to those trainings. The second set of criteria focus on how to support organizations demonstrate their inclusion through ensuring that their policies and practices, such as neglect and abuse policies, confidentiality policies, are inclusive of sexual orientation and gender identity. 3, we recognize the importance of having inclusion across the spectrum, especially as it relates to our employees. Here are best practices that we support you on and taking on in terms of support and insurance benefits for domestic partners, as well as giving guidance for transition-related policies. If you have staff members that are transitioning, or if you want to prepare to ensure that you have the procedure and protocol in place, we help you support and develop those for your community. And lastly, really the last criteria is ensuring that as organizations, you have the best policies and practices in place to let the greater community know of your inclusion. A lot of our elders believe that they have to move to larger cities, that they have to move to the coasts in order to access inclusive care that recognizes their full identity in practice. And the reality is that's not the case, that there are inclusive spots in their local area. It's a matter of helping communities reach their internal goals to be able to share that, and helping our LGBTQ community know where to look and find these folks. The full list is available. I'll go ahead and put the link in the chat here, this tiny URL. But you can also scan your screen in order to access the full list of the LEI criteria, with the exception of criteria 1, which we consider foundational with its non-discrimination policies. Everything else is more of a menu of options, really recognizing that different communities have different budgets or approaches that they want to take when it comes to their inclusion efforts. So just a brief breakdown of what some of these policies are. The non-discrimination in staff training, again, the section is what we consider really elemental in inclusion efforts, not only having the policy in place, but also communicating it. Helping and supporting you all and ensuring that your inclusion and diversity statements are on your websites, that they also can be easily found through Google searches, that you're able to have these policies in the door, on the ground, as folks enter and tour or move in and live there. And lastly, really the importance of that training piece that includes with participating in the LEI and executive briefing that we're able to offer on a learning management system for folks to access. The second criteria, resident services and supports. These are all best practices that are drawn from CMS, from guidance from the National Long-Term Care Ombudsman Program, as well as research and reports that we've done and worked through with the aging field, as well as LGBTQ elders. The first focus is on LGBT resident services and supports. Here you'll find best practices as well as resources on how to have inclusive intake forms, how to ask questions related to sexual orientation, gender identity, the importance of having a rooming policy that's inclusive, that ensures same-sex couples are able to have to share a room. Our second subsection, we're seeing a lot more questions about this from communities, really focuses in on gender affirming services and supports, specifically related to transgender residents. Here, these are best practices and policies relating to rooming based on gender identity, procedures and protocol for respectful interactions between your staff and a transgender resident, as well as best ways to support them within a communal setting. And lastly, recognizing the importance of families of choice within LGBTQ populations, meaning that folks typically have care partners that they may not be legally or blood related to. Really the importance of our community understanding medical decision-making, power of attorney, and that you all as providers have that on available for staff to know and know people's choices. Third criteria, again, as I mentioned, is about those employee aspect of it. We're finding that a lot of the best practices in this area are becoming more and more important as we see culture become more and more as a key factor for what keep people staying at their employer. We find that through LGBTQ initiatives, really we're being able to draw in perhaps a more diverse group of folks and in turn increase our pipeline. And then lastly, these are again best practices on how to reach the general community. We want to know how we can support LGBTQ elders in your communities, reach out to the general population, and also how to support you developing an LGBTQ inclusive logo, having any sort of social media presence. What does it look like to use that as a way to outreach for this population, as well as other marketing opportunities? So I share all this, lots of notes, lots of words, but I'd love to show a video of an actual community that is a long-term care quality index high performer. So they scored in our second tier this past season. I had the pleasure of spending a couple days with Jan and Norma, and we have a short video to speak about their community, Edenwald, and the steps that they've taken in this process.
We met in 1986. We've been together ever since. We really enjoyed each other, and that we complimented each other. Our personalities are quite different, and yet it's complementary.
Well, when I first saw, Norma had a friend that was living here at Edenwald, and I saw this high-rise, and she came back and she said, "This is a pretty nice place." I said, "I am not going to spend my retirement in a high-rise."
Tell them what floor we're on.
17. And the only downside is the birds don't come up that high. It's the best place for us it could be. I mean, we didn't know what to expect, but the openness and the friendliness. I mean, I know everybody that's been here says it's so friendly, and that really is true.
To me, that is the sale. We have gays and lesbians that live on campus. We have staff who are transitioning. I want everybody to feel that they can come here and just be themselves.
We did a pretty thorough research.
We wanted a database that we could search, and there's no such thing. So I'm glad that HRC is doing something that can help other people who are floundering find us.
The long-term equality index speaks to our values as an organization. So that is one of the reasons that I let a staff of residents and community members make the decision that this is something they wanted to pursue because they felt that it spoke to our values.
We asked Diane as we were being interviewed, will we become a problem? The fact that we're a couple, will that be a problem? And she said, absolutely not. And if ever you feel that it has become an issue, let us know.
We are a community of 60 to 100-year-olds, so there's all sorts of people that make up the Edenwald community. But what was interesting is as we started talking about this, we realized it wasn't as radical to the resident population as some people might think. You know, I think once you get to a certain age, you really start to realize that there are certain things that are important and certain things that aren't. And the residents that have chosen to live at Edenwald know that this is not really an issue for them.
You know, it's that type of place that Steve knows everybody at the front, my son Steve, everybody at the front desk come in, hey Steve, how are you? And how are your moms? And so it's just like being at our home.
I want everybody to feel that they can come here and just be themselves, and not only from just a social justice perspective, but also it's business smart. Senior living struggles to staff communities. We, through the pandemic, through the Great Resignation, have been fully staffed here. We have no issue recruiting for any position that we have open because people want to come here because of the culture that it has. You know, most senior living communities are not places that I would go to. I really want to create somewhere that I would absolutely enthusiastically move into.
We feel validated when we're in an environment where people know and it's talked about, not danced around, but talked about. It's very validating to be in a community where you know you are a part of it, an integral part of it, not a side feature.
It's almost a non-issue. The acceptance, you forget about it, that it is an issue, because here it doesn't seem to be.
I had a great time chatting with Jan and Norma when I went with our team to go film this. And I think something that was really important in their story is that in their area was a very openly known LGBTQ centered retirement community, and that they thought would be a good fit because of the culture. And that's where they thought, okay, we could go there, we could be safe. But the reality is that that organization's campus was on sprawling Anchorage. There were lots of mobility challenges that they would have faced, and recognized that while the community felt right, it wasn't the best fit for their future needs in terms of care and support. And so recognizing and finding another community nearby that had taken the efforts to look within their existing policies, practices, training efforts, and really dedicate time and energy into inclusion holistically, and in turn then being able to be, the option that, as Norma said, she didn't necessarily see herself living in a high rise, but actually ended up being a really vibrant opportunity for them to stay active, engaged. They're able to go upstairs, downstairs easily to their classes, and and ensure that they're living their fullest life. I want to leave you with a few resources before I lead to any questions, or if anyone has anything else that they'd like to share. Just in terms of continuing the conversation here with us, the Long-Term Care Quality Index is the name of our project. On our website, you can find more information on how to get engaged or to search some of the other communities, as well as resources and a resource guide on all the best practices that I spoke about. SAGE, our partner, also hosts the National Resource Center on LGBTQ plus aging. This particular website is really the hub of all LGBTQ aging related works and publishing. If you need a webinar, a fact sheet, if you're interested in, how do I ask questions related to sexual orientation, this is a good go-to website for folks to access. And we'll make sure that you all will have the slides and the links to continue to follow up. For those that are working directly with the population and are looking for resources that you could pass on, Sage Connect is a friendly caller program developed through Sage that premiered during COVID, and actually has continued to be a successful program. Folks are able to sign up for a weekly call, a way to really help fight against social isolation. Another great resource to have at hand, both in crisis or if someone just needs someone to talk to, is the 24/7 SAGE hotline. This is for LGBTQ plus elders, or folks who are trying to seek care and support an LGBTQ plus elder. That phone number is 877-360-LGBT. It's 24/7, and actually it's in English and Spanish, but can be translated to over 120 languages through services through 211. For those that are maybe looking for additional resources, there might be some in your area, but not sure where to start. Here's just some tips that might be helpful if you're doing a search or seeking out additional support near you. Really kind of first and foremost, ensuring that folks are having a non-discrimination policy that is verbally expressed, that includes sexual orientation and gender identity. Keeping note if there's any LGBTQ plus imagery utilized, whether that's in the images of LGBTQ plus couples, or even a small rainbow sign somewhere that can be indicative of recognition of the community. If you have an opportunity to engage, or if you're fielding or trying to understand what the culture may be like at a community, long-term care community or social service provider, being upfront and asking if they've had conversation, if they serve LGBTQ plus elders, have they in the past, have they done training on this, just to get a sense of if the folks that this elder will be engaging with have taken the steps to ensure that they're having respectful interactions. Sage Care, it's a venture of Sage USA, also a great resource where you can search by zip code potential LGBTQ inclusive organizations, not just long-term care like the LEI, but also home and community-based services. I want to end with this quote from one of a trans elder that lives in Missouri. She's a retired aerospace engineer, And when asked about the importance of this topic, she had this to say about her community. She said, "It was important to me to find a community that not only welcomed me, but was also close to my family, friends, and parish. I had lived here a year and management knows of my trans heritage and accepts me. To my neighbors and management, I am simply known as Robin, who likes to bake cookies and go to church on Sundays. Access to both independent and assisted living communities is paramount for aging LGBT people. I am thankful for supportive community I now call home." And for many of our elders like Robin, they simply want to be known as Robin, as Dan, who has an opportunity to be a good neighbor and live in community with other folks, especially as many folks seek support because there is none in their immediate circle. So we look to continue to support this journey that you all may have in inclusive efforts within your organization. Here on the screen, you can access a jot form to receive our starter kit that will give some information in terms of webinars, best practices, as well as our resource guide. You can reach us at lei@hrc.org. Really happy to share time with you, especially in my new home of Colorado, as we continue to improve the landscape of inclusion, not just for residents, but for their loved ones and your staff as well. But thanks so much for having me, and happy to answer any questions. And again, please feel free to reach out if you have any more questions.
Thank you so much, Dan, for sharing all that information and those great videos. It was really, I think, eye-opening in some ways to see kind of the challenges, but also the great supports that can be had for older LGBTQ adults. Please do feel free to ask any questions. And again, like Dan said, we will send out this information. But Dan, just a couple questions for you that maybe some of our folks might be interested in. Is there a cost to doing the LEI? Is there a charge?
No, there's no cost associated. Our work is supported with AARP Foundation, Archstone Foundation, and Ted Snowden. So there's no cost associated to applying, taking the survey, any of our resources or anything like that.
Mm-hmm. And then generally, if an organization wanted to go through the process, about how long does it take to kind of go through it? And, what's a little bit about the asks that the LEI has for these organizations? Can you dig in a little bit on that?
Yeah, so the survey opens up at the end of July, and it will be open for about 3 months' time. Really, the process takes as long as many policies and practices as you have. What we do differently than other initiatives in relation to inclusion is that we validate every policy and practice, and then also offer feedback and kind of next steps if folks want to update those policies. So between July until November, those surveys are open. Most folks find that it's helpful to get multiple people on a team, maybe someone from HR, someone that's doing the nursing care, just to get a sense of who has access to those policies and practices. You may need to get connected to your marketing team if you need to upload an ad, or if you have photos from Pride, things like that. And then after that initial period, there's about a 3 more month period where our team then validates and we do back and forth with everyone. So everyone has the best opportunity, to do as well as they can. And on average, about 80% of our participants end up with a builder tier or higher, meaning that they're meeting all of that criteria 1. And I will say again, like states like Colorado, where we already have those protections built into our state policies, a lot of best practices that are being followed through already have on board and now have an opportunity then to kind of expand upon those as well. And then finally, the full report will be published in May of 2025, and folks will have that designation for about a 2-year period. We also will have access to a "You Are Welcome Here" seal that can be placed in the windows as well over that 2-year period. But we have a couple communities, one in Canyon City, one in Boulder, one in Aurora, and one in Denver. But we're looking to, continue to grow. And I think what is so important for many of our LGBTQ elders, especially, is just seeing organizations trying. There's no expectation that we have of anyone doing this perfectly. And a lot of it, again, is still fairly new, unlike the hospital systems that had directives that came down through the Affordable Care Act and things of that sort. There isn't as much within the realm of skilled nursing, and especially if you get into assisted and independent, where there's not as many stipulations and things of that sort. So really a lot of these best practices are coming from those that have been leaders in the field. I had made mention, we're starting to see states like California, New Jersey, New York pass LGBTQ resident Bill of Rights that actually specify inclusive policies in residential long-term care for LGBTQ seniors and those with HIV. So we're seeing some movement in that as well, and in favorable states where we see progress. That's a potential that we could see down the line in Colorado. And so, thinking ahead in terms of who are the elders we're serving now, who are we going to be serving, and also recognizing we're seeing straight older folks as well seek out more inclusive communities because they have gay children and they want them to feel comfortable visiting them, or they have a trans grandchild and they want to know that that grandchild is welcome to come to Grandparents' Day, just like anyone else. And so we're starting to see inclusion mattering to a greater audience and recognition again of how it's kind of a holistic approach, and one that happy to help support you all in.
Great, thank you so much. Other questions for Dan or about the process or anything like that?
And I'm just throwing my email in the inboxes as well. But I'll definitely make sure that you all have the slides of what we spoke about, as well as some of those links that might be helpful, and some additional resources in terms of webinars that could be helpful too.
I have a question.
Yeah, Carrie?
Hi, thank you for this. This was really great. I might have missed it, but are there things, so I work for a housing authority. So are there things that this LEI organization can help with as far as creating a welcoming environment in the housing authority?
Yeah, so we currently work with like affordable, as long as it's age segregated, affordable housing communities. So a lot of the best practices can be applied. And we've had, I would say maybe a third of our maybe even half at this point of our properties are affordable senior housing. And so, we also work with you all in terms of recognizing you may have a different, like you may not have a visitation policy in a way that a skilled nursing community does, but you can include language like visitor of choice or certain imagery in order to support. So you all would be a potential eligible for this sort of approach, and a lot of those best practices could still apply. Mm-hmm.
Yeah, great. And I just think, like you said, just putting that simple sticker in the window, like we all know to look for that, right? So I think just doing that, I hadn't even considered that yet. So thank you for that.
A lot of the suggestions and a lot of the policy changes or best practices, for the most part, are subtle changes, or they're changes that happen really more internally that will then be communicated to staff. But it is those subtle changes that either affirm kind of what you already know and what your community is, standing by, or it just continues to strengthen some of the approaches. I think one thing that's, like I said, has become more apparent and more important that we're seeing are communities having guidelines in place of what happens when someone transitions, whether they're a staff member or an employee, whether they're an employee or if they're a community member, one of the residents. And so, we have guidance that we've developed with Lambda Legal, as well as some of the national hospital associations, that kind of go step by step of what are the best practices, as well as, the protocol that can then be helpful for you all internally so that your staff at least feel comfortable or know like what to do in those scenarios. And so we have a resource guide that is an accompaniment of this as well that can be helpful for folks. And that, again, extends some of those best practices. And I'm just going to put it in the chat so folks can access that, but we'll follow up. But there's, I think a lot of growth that I've seen. I've been working in this realm for about 12 years now, specifically kind of at this intersection, and starting off in Missouri. And I would travel all across the state and often, it was at a point where people would say, well, we don't have any LGBTQ people here, or just forgetting that I think they thought we just all like exploded in a puff of glitter at the age of 65 or something and, disappeared. But, once you start to help people understand why it is that people are being quiet, why it is, that folks may go back into the closet or just avoid care altogether. And I think part of this is also utilizing our leverage as HRC Foundation and SAGE to help our aging community know that there are providers that may even be members of the community that want to be able to, create these spaces. But it's hard, especially with national rhetoric and things of that sort, even though it may not be targeting this older population, it still, can lead to anxiety. So it is more of a push as providers for us to then take that step, even in the subtle ways of just a small rainbow here, or, recognition or a declaration of, we believe in everyone welcoming and belonging here, to just take those extra steps to ensure folks know that they're considered, especially as we see more guidance from CMS come in and really center person-centered care, or culturally appropriate care. We're even seeing some language around our trauma-informed care is culturally competent care. So how can we ensure that these initiatives are also recognizing their alignment with a lot of the missions that these organizations were founded on too? Thanks for the question. So yes, everyone, please feel free to reach out. I see we got a few folks downloading the form. If you have any more questions, again, the survey opens up in July. It's open up for 3 months. And then it is a back and forth process where you don't necessarily have to have perfection, nor is that expected. We really are, excited to continue to expand the network of where folks can go, being able to access both of our websites and type in your zip code, and being able to lift up communities in your area that have taken on this charge. I look forward to supporting that.
Thank you so much, Dan, for all your work on this and all your efforts. We appreciate it. And that is probably a good place to stop for today. If you have additional questions, definitely reach out to some of those resources that Dan has pointed to. And the PAFC is here to support you, and hopefully you'll all continue to work toward these efforts. So thank you very much.
Thanks.
Have a good day.
Take care.